Hey, Dr. Tyler Williams with Pinecrest Dental. Thanks for checking out today's video. I'm here to answer a question that people commonly ask, which is, hey, if I'm getting a crown, should I also get a root canal? Or every time I've had a crown, I've also needed a root canal. So should we just get the root canal done? Or maybe the opposite is, hey, I'm scared to get a crown because I'm worried it's going to hurt and then I'm going to need a root canal. These are very common concerns with thousands and thousands of people. And it's often a reason that people are fearful or don't want to go to the dentist. And I don't blame you. I've had one root canal, and it was just a couple years after I became a dentist that I had a tooth that I had some old dental work replaced, and it started to get that ache, and I knew what that meant. And so I went quickly, had the root canal done because I didn't want it to get worse because I knew well the signs and symptoms of root or nerve pain or infection or damage. So the root canal done. Now, I've got an option that's better than both of those, which is don't get the crown and don't get the root canal, but still improve the strength and health of your tooth. And we'll go into that a little bit in just a moment, but some basic knowledge on what a root canal is, okay, is it's a little bit of a misnomer or a wrong saying because a root canal is actually a natural part of your tooth. So that's kind of like saying that if your knee hurts, it's like saying, do I need a knee disc, right? Well, or do I need a kneecap? We all have kneecaps, okay? We all have root canals. Every one of my teeth has a natural root canal. That's where the nerve and the life is of your tooth. There's blood and nerves in there. That's what helps us feel cold when we drink cold water, or if we bite down on something sharp and we feel pain, right? Or if we get knocked in the mouth, or if we eat some food and it's too hot and it's going to burn us. That's our body saying, hey, we need to avoid what we're doing. But if you have a deep cavity into a tooth, sometimes the bacteria in that cavity infects that nerve, and sometimes that happens before it even shows up on an x-ray. And so you look at that and say, well, we're going to treat this without treating the infected root canal in your tooth, and we're going to try to avoid that. But then sometimes the root canal ends up happening, and that's never fun for anybody. So what I've learned and what I've transitioned to is a type of dentistry called biomimetic. And if you break the word down, you're mimicking biology, or you're trying to follow the natural enamel shape of your tooth. Crowns weren't really that big until maybe the 60s or 70s, when people started to want more cosmetic treatment. And before that, teeth were actually made with gold a lot. There was gold inlays, gold onlays done on teeth. That's where you would cover just the damaged part of the tooth, not drill the whole tooth down to put a cap or a crown over the top. But as people wanted their smiles to look white, they wanted to get rid of gold. And so these crowns that were ceramic, and they're fused to metal. So there's metal underneath, ceramic over the top. Well, you had to cover the whole tooth so you didn't see the metal and so that it looked white. But in doing so, you have to cut away anywhere from half to 2/3 of your tooth. And so when you do that, you get really, really close to that nerve. And sometimes, without even seeing it on the x-ray or in the hands of the dentist or the operator, is reducing that tooth or shrinking the size of that tooth down can nick the nerve or clip the nerve, or just get too close and bang on it. And if you have a nerve that's already mad because there was bacteria from the cavity, and then you go and hit on that nerve, that can aggravate it to the point where the nerve dies, right? It gives up. And as it dies, it shrinks down and it turns necrotic. And necrotic means that basically bacteria grows inside, and then it grows and pressurizes, and then it hurts. And this is something that can be confusing if you're wondering why. Well, I came in and I had no pain, and now I got all this dental work done, and now I need all these root canals and I have pain. And that is very frustrating because I've gone through the same thing as a patient. But with biomimetic dentistry, we're not doing crowns at all. We're still using ceramic. We're still using tooth color dentistry. But we're also using techniques that were around for hundreds of years before crowns, which is inlaying your tooth or onlaying your tooth. And that's where we save as much as twice as much or more of your tooth. And in my experience since doing that, our chance of root canals has gone down substantially. It used to be that maybe about 1 in 5 teeth or 1 in 4 teeth we would put a crown on would need a root canal later. And that was very frustrating for me. I didn't like putting my family or my patients or my friends through that. But as I learned more about biomimetic dentistry and transitioned my practice to that type of treatment, now it's maybe 1 in 30 teeth that need a root canal. And that's usually because the damage was so extensive before we got into the tooth that the root and the nerve were already dead. And so we need to do a root canal treatment to save that tooth. If you have some more questions on biomimetic dentistry, or if you hate going in and getting crowns and root canals, and you hate even remembering your experience at the dentist, please give us a call and we can talk about some options. We can go through with you at a consultation and see if biomimetic dentistry might be the new way for you to have the most healthy, natural, even cosmetic looking smile if that's your goal, but without the aggressive and painful root canal. So thanks for checking out this video, and we'll see you on the next one. Have a great day.